My name is Dr. Romero and I'm part of the Montana Equine team. So today I'm just going to talk a little more about joint disease and the anatomy of the joint and the functions of the joint and a little bit of the treatment that we have available now. So just to start, I'm just going to say that the musculoskeletal disorders are the most common reasons that people try to make an appointment with the equine vets. So the joints have different functions, but two of them that I think are the most important ones. First of one, they permit to have like a smooth and frictionless motion between the bones. And the second one, they mitigate the vibrations and accelerations that just is caused just because the hoof is landing in the ground. So that's the reason we need to have a healthy joint in every equine that we see. So we have different type of joints. We normally have 3 types of joints in the horse. So today I'm just gonna talk about one, which is the most important one, is the synovial joint. So when I say synovial joint, I refer to knee joint, to the fetlock joint, to the pastern joint, and to the coffin joint in the front limb. And in the back, I can say the stifle joint is also a synovial joint, the hock joints, and the fetlock, the pastern, and the coffin joint again. So that's what I'm gonna talk about a little more. So the joints are composed of a subchondral bone, which is a part of the bone that is closer to the other bone, a joint capsule and synovial membrane that are like the walls of the joint, and the joint cavity that contains the synovial fluid. So also we have the articular cartilage, which produce the components of the synovial fluid, and collateral ligaments. I will try to explain in a simple way what is the joint disease and why we need to give some maintenance to the joints through injections and or supplements. All of the components of the joint that I mentioned before, they need to be on balance, which we normally call that as a homeostasis, which means that all of them need to be healthy and to work together. So the basic reason we have a joint disease or we have a problem with a joint is because the joint loses its balance. So let's think about a horse that has a trauma that can be caused by a laceration, by a soft tissue disruption, or just a repetitive trauma that is generated every time the horse jumps or runs, or just talking about high-performance horses. So this trauma will cause some inflammation on the joint capsule and synovial membrane. That inflammation will release inflammation enzymes and cells, which will cause a degeneration of the articular cartilage, creating a low quality of synovial fluid. Instead of being like viscous and thick, it's gonna just start to be like watery. So that's gonna end in changes on the subchondral bone. So then it's what we say, well, there's some osteoarthritis in the horse. So all of this results in a lot of pain to the horse. So they start to be lame or sore or not sound. So currently we have a lot of options to treat joint disease. One of the most common ones is doing intra-articular corticosteroids injections, which means that we normally put like triamcinolone or beclomethasone or methylprednisolone in the joint. Just to be clear, the only thing that we do with these is just decrease the inflammation and try to relieve a little bit of the pain, but it's not actually healing the joint itself. So then we also have another options. It's kind of new therapies that we have available. So it's a biologic treatment, which is like PRP or prostrate or IRAP, stem cells, and there's a lot of combinations now available. This is actually a really good option to try to do in the horses, because they're gonna decrease inflammation, they're gonna relieve the pain, but they're also gonna try to heal the joint. So the things that they're gonna do is just like add more nutrition to the joint, add more nutrition to the articular cartilage. So that's actually a thing that we need to keep in mind, that is a really good option, even if it's a little more expensive. We also have some supplements that are gonna be available to put it on the diet or just do like IM injections. And the most common one is Adequan, which I think we normally, all of us know what's the deal with that product. So it's just nutrition to the joints. You don't need to wait until your horse is completely lame or completely off. We are happy to do a musculoskeletal exam on your horse, and then we can discuss about all the treatments or all the options that we have just for maintenance according to the expectations that you normally have for your horse. So please do not hesitate to make an appointment with us.